Assalamu alaikum dear students. In our today's lecture, we will discuss some of the common problems faced by any person with respect to his stomach. And so, we will be discussing the common disorders associated with. We will discuss the common disorders of stomach. Common disorders of stomach. Till now, you came to know about the wall of the stomach, about the prevalence of different types of the muscles in the stomach, in which you came to know about the presence of the longitudinal, circular and the oblique muscles meant for exhibition of different movements leading to churning of the food and emptying of the stomach or peristalsis. And you also came to know about the greater and the lesser curvature and the cardiac sphincter and the pyloric sphincter, their roles. And you also came to know about the presence of different types of the gastric glands and the mechanism which was being operated over the gastric glands for having good secretion of their respective secretory cells, in which we came to know about D cell, G cell, these chief cells or the peptic cells or the parietal cells or the oxantic cells, and we also came to know about their mucous cells and other things. And we also came to know about the role being played by different hormones secreted by this and that region for having a regulation over the synthesis of the gastric secretion. And we also came to know about the role being played by our central nervous system in the regulation or in the initiation of the gastric secretion in its different phases, whether that was about the intestinal phase or the gastric phase or the cephalic phase. But in our today's lecture, we will be having a look over some of the common disorders being faced by any person. You know that our stomach, so far its entrance is concerned, consists of a gate-like structure, what is known as the cardiac sphincter, which is allowing the regulatory movement of the bolus to get its entry into the stomach. Sometimes there is a problem being faced by this very region. You know, sphincter consists of the muscles. When these sphincter muscles will relax, their relaxation will lead to entry of the bolus. It is the bolus, it is entry into the stomach. Sometimes what happens, due to some reasons, these specific sphincter muscles are not relaxing. When they are failing to get relaxed, they are leading to a condition in which the food will be accumulated in this very region, in the lower esophagus, not in the stomach, and such a problem is called as achalasia. Achalasia. So, what is achalasia? Achalasia is a problem which develops there due to failure of cardiac sphincter muscles to get relaxed. Failure of cardiac sphincter to become relaxed. See, when this failure will take place, that failure is called as what? Achalasia. And if the achalasia will remain there for months, for years, that will lead to accumulation of the food there. And the condition at many times reaches up to this extent that instead of taking some seconds to get entry into the stomach, now this bolus is taking even hours. In more than an hour. When such things happen, the food accumulates here. When more and more food accumulates here, that leads to development of the pressure over the wall of what? Esophagus. Then esophagus dilates, and ultimately this esophagus is enlarged. This is not the normal esophagus, this is now enlarged esophagus. So, achalasia can lead to enlargement of the esophagus, especially in the lower region. Then you can think by yourselves that what problems can be faced by a person when he develops such a condition. But here, when this condition remains there and when it reaches up to this climax, that now the swelling or enlargement of this lower part of the esophagus has taken place, and that condition is called as Megaesophageal condition, and the esophagus is called as megaesophagus and the condition as megaesophagia. So, what is megaesophagia? Very simple. It is enlargement of esophagus. I will write down here simply. It is enlargement of esophagus. Though it is the problem which is associated with the esophagus, but you know this is that part of the esophagus which is directly linked with what? With the cardiac part of our stomach. So, this problem can lead to generation of another problem into this very region of our stomach. So, unprevented, uncured achalasia not only will lead to development of the megaesophageal problem, but it can also lead to development of the problems associated with the cardiac region of our stomach. And next problem which is faced by our stomach at many times, and the common problem is known as gastritis. Gastritis, it is a very common problem. What do you know about gastritis? Simple. It is an inflammation of gastric mucosa. So far as the wall of our gastrointestinal tract or our stomach is concerned, we came to know that it consists of the mucosa, submucosa, of the muscles, the lung, the circular, the praxis, myenteric system, and isn't it, the lymphatic vessels and the blood vessels. So far as the mucosal wall of our stomach is concerned, when that mucosal wall of our stomach gets irritated and gets inflamed, then that very inflammation of that gastric mucosa is called as gastritis. So, I will write down here, gastritis is what? Gastritis is inflammation of gastric mucosa. If this is the gastric mucosa, this, let me show it is inflammation in the blue color. See, this is the inflammation, this is now the inflammation of your gastric mucosa, and that inflammation is called as gastritis. Now, the question is, what are the reasons lying behind this gastritis, and what will happen to a person when he will be suffering from gastritis? First of all, you should know that the gastritis can happen in adults, and it can also happen in, rather mainly it is being experienced more by the middle-aged persons, middle-aged. And when a person suffers gastritis of the lower context, sometimes gastritis, the limit of the gastritis is very simple. When it is not affecting the gastric secretion, the process of digestion in the stomach, and the process of churning of the food and other functions being performed by our stomach, when it is not affecting such things, then we will write down for that is simple form of gastritis. So, in the simple form of the gastritis, there will be normal digestion of the food, isn't it? There will be normal sort of the functions being performed by the different gastric glands of our stomach. Here normal function takes place. Normal functions of almost all gastric glands. So, digestion will be normal, protein digestion will be normal, lipid digestion in the stomach will be normal, isn't it? And sometimes in the simple type of the gastritis, a person may feel some sort of more acidic nature in his stomach, some sort of the bloating and other simple issues, which can be overcome after he will consult a doctor, and a doctor may recommend him some antibiotics or some simple medicine, and this problem will be overcome within days by the respective patient. But sometimes this simple gastritis develops into the another form of the gastritis, which is called as chronic or acute. Sometimes chronic form or acute form of gastritis can be there. Most commonly, the chronic or acute form of the gastritis takes place because of use of some these environmental substances which are unwanted, like here in this acute gastritis, there is not normal functioning of the gastric glands. There is some abnormality. There is some abnormality in gastric secretion even, and gastric function. This chronic and or acute gastritis can be because of, it can be because of alcohol, use of alcohol, or some drugs like aspirin is there. Sometimes the people who have used more and more junk foods, more and more soft drinks, continuous medication, continuous unprescribed, unrecommended, I should write down here, self medication. When a person does this limitlessly, this self medication, or sometimes a person takes more and more soft drinks for longer times, or he is using junk foods for longer times, or he is using aspirin, which might would have been recommended to him by some doctor to address any issue, but he uses it continuously, or a person uses alcohol. All such things can lead to transformation of simple gastritis into what? Chronic or acute gastritis. And this chronic or acute gastritis can also take place there because of some bacterial infections. But this chronic or the acute gastritis can easily be managed by the gastroenterologist. If a person visits a gastroenterologist, he will easily address this issue. But sometimes there is another issue which is more severe than this chronic or acute type of the gastritis. Let me check first whether I am getting recorded or not. Yes. See here, sometimes a person suffers from gastric ulcers. What are gastric ulcers? Now, these are a sort of perforations, isn't it, or sort of injuries of the gastric mucosa. Gastric injuries are what? Gastric ulcers. But here we should know an important thing, that the gastric ulcer is a problem associated with some defect lying with the barrier of the stomach. So far as the barrier of the stomach is concerned, I have already told you that our stomach consists of mucous cells. So these are, let me write down here, these are mucous cells. And what was the role of mucous cells? To synthesize thick alkalinated mucus, which was doing what? Which was acting as a buffering agent and which was acting as a barrier for acidic HCl to get its action over the wall of our stomach. So it was protecting us from getting self-digestion with pepsinogen or with what? With hydrochloric acid. And so far as the barrier is concerned, we have another barrier, the epithelial lining. Let me make down here some cells. The epithelial lining of the stomach, consists of very close junctions. In the histological portion, you came to know that sometimes the cells in a tissue are so much closely associated with one another, very tightly associated with one another, that they are not allowing anything easily to get its entry deep into the cell or into another tissue. And such junctions are called as tight junctions. So there are two main mechanical as well as biochemical barriers. Now, it is prevalence of these tight junctions in the epithelial lining and presence of these mucous cells. And presence of these tight junctions are not allowing the absorption of different things in the stomach. You know that very least amount of absorption is taking place in stomach. However, there is exception with respect to alcohol and some drugs and some other things or water. They are exceptionally being absorbed. But when there is a normal amount of presence of tight junctions along the epithelial lining of stomach wall, then less absorption of different things will take place. The main thing here was that of the HCl or the proton ionic concentration or the pepsinogen or the peptones or the peptides or monosaccharides or the disaccharides, isn't it? But because of these two barriers, no absorption or negligible absorption will take place. And it is because of these barriers that our stomach wall is being protected by or from getting digested by its own digestive or degradative secretion. Now, in gastric ulcers, when there is prevalence of chronic or the acute gastritis for years, for months, for longer times, or when a person gets some infection of some deadly bacteria like Helicobacter pylori is there, then gastric ulcers or some sort of injuries will be there, and those injuries will be as deep as up to the mucosa. Say here I will make an injury. Say here this is an injury. This injury is gastric ulcer. So, gastric ulcer is that condition of our stomach in which there has been a sort of havoc in the gastric mucosa. I will write down here, there is a sort of gastric havoc with respect to gastric barrier. Now the barrier is not there. When the barrier is not there, then the proton ionic concentration or the pepsinogen or HCl will be having an easy access up to the mucosa. Easy access up to the mucosa. And you know that there is presence of neurons, there is presence of myoenteric neurons and the nerves or the nerve endings from the vagus nerve, which is associated with our central nervous system, and even parasympathetic, sympathetic centers are also lying there. Such types of the neurons are also there. So when such things will happen, now the person in such type of gastric ulcers will also be feeling even pain and the other problems which you can understand by yourselves. And sometimes if the gastric ulcer will continuously remain there in the stomach, then the developing gastric ulcers can lead to the atrophy of that region of the stomach, a condition what is known as gastric atrophy. So here we will write down that another condition can be there known as gastric atrophy. In gastric atrophy, what happens? The main thing which happens in the gastric atrophy will be that there will be now inability to having a normal secretion of what? The gastric juice. Inability for gastric secretion. This will be the serious problem now. When a person develops inability for having his gastric secretion, you can yourself understand that what will happen to his bolus. He won't be in a position to digest the collagen, to digest the protein, to digest the some lipids, and to digest the carbohydrates under the influence of the ptyalin which was present along with the bolus. So when even the digestion process will be altered or will be diminished in the stomach, you can yourself understand that in such a person weakness will be there and loss of weight will be there, and so far as his red blood corpuscles are concerned, their number will be reduced. Why? Because whenever there is inability of some specific parts or more parts of the stomach for having their respective secretions, then in that person there will be less and less secretion of the intrinsic factor, about which you came to know in your previous lecture. And this intrinsic factor, which was being secreted by the parietal cells, it was responsible for the absorption of vitamin B12. So if the same person will be taking vitamin B12, he won't be in a position to absorb the vitamin B12 because he is lacking the intrinsic factor. And you know that vitamin B12 in the bone marrow was responsible for synthesis of RBCs. So when there will be lack of vitamin B12, then bone marrow won't synthesize more and more RBCs. So the person will be suffering from a special type of the anemia in which the RBC count will be less, known as pernicious anemia. So problem was lying in the stomach, but it surfaced in one's blood. And pernicious anemia will be there, then you can yourself understand breathlessness will be there, and lethargy will be there, laziness will be there, dizziness will be there. There will be lack of oxygen faced by the different tissues of the cells which would have been otherwise used for their cellular level of the respiratory processes. This is number one condition. Number second condition in gastric atrophy can be when there will be least gastric secretion, then the secretion of the hydrochloric acid will also be less. And when the secretion of the hydrochloric acid will be less by the respective oxyntic cell, that very condition is called as achalasia. Achalasia. What is this? What is this? Very simple to remember. when there is least secretion of HCl, isn't it? When a person will be facing achalasia, then there will be least secretion of hydrochloric acid. When there will be least secretion of hydrochloric acid, then there will be nothing to convert the pepsinogen into pepsin. And once again, the digestion of the protein is the big breakdown of the peptide bond would take place. So, person is now reaching up to that state that if he will take beef, if he will take mutton, if he will take fish, chicken, protein rich diets, he would be in a position to digest the same food items. So, in Accoladia condition, there is less secretion of HCl, and when there is less secretion of HCl, then along with less secretion of the HCl, now there will be the less secretion of even this pepsin as well. When overall gastric secretion will be diminished, then that very condition is called as hypochlorohydria. That very condition is called as hypochlorohydria. Let me write down that here. Hypochlorohydria. So, in the hypochlorohydric condition, a person will be having less gastric secretion, irrespective of all the mechanisms which we discussed in our previous lecture. Less secretion of gastric juice or less gastric secretion. These were the conditions associated with what? With the gastric atrophies. And in some more cases, in which in a person the secretion of the hydrochloric acid is more, isn't it? Or this barrier fails to exercise its powers, which it was operating to protect the cell wall of the stomach. In such conditions, the HCl or even pepsinogen itself can lead to development of some ulcerations in some specific regions, like this region here in this region, or here in this region. These are the main regions in which in most of the patients the peptic ulcers have been seen. Peptic ulcers. Peptic ulcers develop because of inability of that person's these barriers to having their effects over the pepsinogen or even over the HCl. So, the defect can lying be in the oxyntic cell for having it as excessive secretion, or the defect can lying be the underlying mechanisms which were being operated over the parietal cell for having it as regulatory or limited secretion of the HCl. Defect can be anywhere, but whatsoever will be the reason, but whenever the action of the pepsinogen or the HCl takes place over some specific regions of our stomach, the special among which are this and that very region, and there is development of some specified ulcers, what are known as peptic ulcers. And these peptic ulcers are actually the outcome of this and this condition or any other such condition. Sometimes the peptic ulcer develops in the marginal side of the stomach, and that very peptic ulcer is called as marginal. That is respectively called as marginal. So, dear students, these are some of the common problems which are associated with our stomach. Here, let me write down some prophylaxis. Let me write down some prophylaxis which we can operate by ourselves for getting rid of all such common problems. Very recently it has been seen that there are some types of the special strains of the bacteria which are called as Helicobacter pylori, and it has been seen that these Helicobacter pylori are responsible for having a degradative effect over the wall of the mucosa of our stomach, that also can lead to the development of the peptic ulcers, because they are having the ability to hardwire themselves, to adapt themselves in any these gastric conditions, and then they are present in the epithelial muscles, in different types of the glandular these cells, and in the epithelial cells as well. Then they can produce some toxic substances, and that those toxic substances will lead to the degradation and formation of the ulcerative these regions or lumps in the wall of the stomach. So Helicobacter pylori is nowadays said to be the common cause, most common cause should I say, for the formation of the peptic ulcers. But there are some prophylactic measures. There is a good thing for us to hear, for us to learn, that if we adopt some major prophylactic measures, then we will be in a position to get rid of some of the major stomach or the gastric problems. Let me write down here a few among them. That is good feeding habits. We should have good feeding habits, in which we should divide the whole day into different parts, and then we should take our meals, our food, our lunch, our breakfast, our snacks in definite intervals, and we should take our food in such a way so that we won't be allowing our stomach to remain empty for more than 5-6 hours, and in which we should allow our stomach for not getting our food after we have taken meals. There we should take some rest, isn't it? Least cases of the stomach problems by the normal persons have been observed by different people in the month of the Ramadan, because proper dieting timetable is being followed. So when we properly provide food to our stomach in proper intervals, then our stomach gets adapted, and it develops a biological clock in itself, that in those respective times it used to synthesize and secrete its gastric secretion. Because you know that the psychological factors, the visual factors, and the thought factors and the stress conditions were all responsible for having their role over the regulation of the gastric secretion or the gastric glandular secretion. So we should manage good feeding habits with respect to proper intervals of the time. And number second, neither we should take more acidic food nor we should take more basic food. How we will overcome that issue? We will overcome that issue by taking a balanced food, which we will discuss in detail in our coming lectures. But here you should know that in a balanced food, we have every type of biomolecule, like proteins are there as per our requirement, lipids are there as per our requirement, vitamins are there, minerals are there, water is there, fiber is there, everything is there which is being required by our body, and all such things are present in their respective concentrations, and we should make use of balanced food, that too regularly. And number next is that we should avoid something. We should avoid, number one, self-medication. In self-medication, we don't know that what will be the impact of this medicine, that antibiotic, this paracetamol over the lining or over the mechanism which was being operated at the molecular level over the parietal cells, or even over the other types of the cells which are present in the gastric glands. So when we are using the medicine on self basis, on behalf of our self consultation, then what we are doing nothing but we are deteriorating our lining of the wall of the stomach, that can all lead to development of such problems. As you have seen that aspirin can lead to formation of these chronic or the acute gastritis, or that can lead to development of all such other problems. So one should take medicine only under the recommendation of a good medical practitioner. And number second, we should avoid taking alcohol. We should avoid taking alcohol. And number third, we should avoid taking junk foods. We don't need these junk foods. We don't need these soft drinks. They are doing nothing. The junk foods will induce our more gastric secretion. They will induce the parietal cells for having more acidic secretions that can lead to development of these issues, or even peptic ulcers as well. And when we are taking soft drinks, the incorporation of the soft drinks, they are carbonated, and different gases are present in there. And then those gases, when they get entry into our stomach along after we are taking them, they can lead to uneven, which is not needed by our respective sphincters. They can lead to uneven opening of the cardiac sphincter or uneven opening of pyloric sphincter. That can lead to uneven entry of the gastric food into the duodenum, or gastric uneven entry of this gastric chyme into this region, or this gastric chyme into this region, and that acidic paste-like chyme in this and that region is not being withstood by the respective linings, and they can lead to development of ulcers in even these regions as well. Sometimes the esophageal ulcers or the duodenal ulcers, which we see in some patients, are because of the uneven relaxation of these muscles or these muscles, with which unwanted acidic substances might have got their entries into this or that region. So we should avoid such soft drinks. Taking soft drink is just an illusion that I have taken soft drink and it has made my stomach empty. In your previous lectures, you came to know that emptying of the stomach is under the regulation of the vagus nerve, under the regulation of the myoenteric nervous system, under the regulation of these different endocrine substances like CCK was there, neurotensin was there, secretin was there, gastrin was there, serotonin was there, and so many other factors were also responsible for having normal emptying of the food. When we are these anthropologically, or we are synthetically inducing our stomach to get emptied, that can lead to development of these major issues in our stomach. So we should avoid all such things. And number last, when we will be facing any such problem like burning sensations, like pain sensations, like more cramping sensations early in the morning, in the midday, in the late evenings, or in any times, then at last we should consult a good gastroenterologist. So we should remain very cool, and we should practice very good food or feeding habits with respect to our maintenance of good gastric health, and we should always remain stress free, because stress can also lead to the over or under synthesis of serotonin, which can lead to over secretion of the gastric these enzymes or the hydrochloric acid. Then you know that because of over synthesis of such things, all such problems can be there. So with this, we have concluded our today's lecture. In our coming lecture, we will be discussing the mechanisms which are being operated for the food, or for having its proper digestion under the influence of different enzymes which we get from the pancreas, from the different glandular cells of the intestine. Till now, stay blessed and goodbye.